So what causes sciatica? This seems to be a surprisingly contentious issue. So I would say that the main two theories for this are that we either have some sort of issue occurring at the spine directly, so at the lower lumbar, like perhaps something is herniated, and then the other side of things is that maybe we've compressed the nerve around the piriformis, and we're getting something called piriformis syndrome where we're going to get this shooting down our leg. And that's essentially imitating sciatica. Now, I've been reading Nikolai Bogdach, who is a professor in anatomy, or former professor, and he had some surprising things to say about this. Long story short, as far as I can tell, he essentially said that piriformis syndrome wasn't real. Now, to really explain this, I think we need to back up a bit into the anatomy and the types of pain that you can experience. Okay, so sciatica is ultimately a nerve pain. It's shooting pain. Now, there's different types of nerve pain. So we can have a radiculopathy. Basically, radiculopathy just means that the nerve can't conduct properly. It can't send the signal properly. So if you have a problem with the motor nerve, you're going to have a problem with actually creating movement. And if you have a problem in the sensory nerve, it's going to feel numb. Now, this is caused by compression, but doesn't cause pain itself. So this is where we would start to sort of question what's going on with piriformis syndrome. Right, so piriformis syndrome is essentially, supposedly at least, so the piriformis, one of the rotators of your hip, will essentially compress and impede on the nerve, is the argument, and that's going to cause these sciatic symptoms. So if we follow that same train of thought from a radiculopathy, we would argue that it wouldn't be causing that pain, it would just be causing some sort of numbness or weakness. Where this gets confusing, so Bogdach was clear that whilst it doesn't directly cause pain, you could also have radicular pain, and it seems that those could occur simultaneously. Radicular pain is that classic nerve pain. It's that shooty, stabby pain. So again, those radiculopathies don't cause that pain, and apparently compression generally doesn't cause that pain. So it's hard to justify that piriformis syndrome is essentially what's happening here. He would argue is that there might be a couple things happening. So one is that yes, the spine aspect of it is accurate. You've essentially had some form of herniation, so something's come out of the disc, and that disc material is now causing inflammation, and that inflammation is the cause of the radicular pain, so the nerve pain. Now, the other argument here that he makes as well is referred pain. So referred pain is this area isn't directly affected, but something else is referring pain to it. It's causing pain there. Now, this is a pretty weird phenomenon to occur. He said that this happens because of something called convergence. So essentially what this seems like is some sort of sensory nerve touches, converges with another nerve, which tricks the brain, because now the brain can't really figure out which nerve caused the problem, and now that's sending a referred pain to that other area. And he said that this is normally a rather diffuse, deep, and achy pain. Now, as someone who's had those sort of sciatic symptoms, if I think about what that's felt like, yes, I have had, say in my deep hip, in my glutes, that deep achy pain, but I've also had the classic nerve shooty, almost lightning-like pain down my leg. To be fair, I've definitely had spine issues, so that could be a cause, but also when I've done work on my hips, a lot of that sort of sciatic symptoms have gone away, and with it some of that dull achy pain in my hip. So it's sort of hard for me to reconcile from a theoretical perspective versus what I've experienced anecdotally there, because I'm not really seeing the absence of piriformis syndrome. And when I've read, I believe it was McGill, Dr. Stuart McGill, excellent spine biomechanist and clinician, I'm pretty sure he's talked about this before. He's like, piriformis syndrome definitely exists. And look, it's possible that I'm misreading Bogdach here and he's not saying that it doesn't exist. It might just be some other weird category of thing that's happening, but that seems to be what I'm getting from this. Now, for those of you who don't know, I've been learning all of this and much more as a part of my 50 Days to Rebuild challenge, where I read 50 pages of a physio/exercise book and do 50 minutes of exercise in a day in attempts to rehab myself. Now, I did learn a few other things from what I read today that are sort of unrelated to sciatica, but I do think they are very interesting and compelling. In terms of how the spine goes with age, so apparently the trabecula, which are like the little struts within the spine, they start to deteriorate, specifically the horizontal ones, so the spine is essentially more likely to have damage caused to it. Also, apparently the discs start to dry out, which means that they become more susceptible to creep, which It's something that I discussed in, I believe, a previous video, which is essentially just like you're in a weird position. Now you've sort of stretched something and it hasn't gone back to its initial position. It's like if you overstretch a rubber band, and that takes longer to recover from. And that's about it for the learning side of things, but looking at the exercise portion, I've kept up the lack of knee exercises. My knee seems to be getting better. I hate that rest works. I've fought against that idea for a long time, but in this scenario it seems to be helping a bit. Everything but the bird dog seems to be going well when I look at the McGill Big 3. And this was really just because it feels and looks like I'm still hyperextending. This is doing my absolute head in. I don't know how to fix it. But because of this, I did try and work on my psoas a bit, which had some sort of mixed results. Now, it felt good on the right side, but on the left, I had a massive external rotation. Now, I did some capsule work, trying to really pull on the hip, and it felt good during. I modified this, I've never done it like this before, where I tried to sort of lay down, have it pull on my hip directly downwards, and then I sort of pushed myself forward into extension, because I always feel like I start to impinge my hip in extension. So I was hoping this would fix that. It felt really good during and then way worse after. So yeah, has me a bit concerned, like, you know, is my pelvis tilted in some sort of way? Like, why can't I fix this? Why can't I internally rotate my hip, essentially? And the wrist work is going really well. I'm really happy with that. Hopefully that keeps up. Again, trying to essentially pull towards the radial side, so the thumb side, and then extend. And that seems to be feeling a bit better for me. And yeah, that is about it for day 38. Thanks for watching, and I hope you have a good one. Cheers.